tell me about how long did you have pain in your back and the legs?
About 2.5 years.
How bad was the pain, 1 to 10?
At that time, probably about 6 or 7.
Okay.
And just gradually kept getting worse.
Okay, how bad, 1 to 10? Was it at the end?
Then I was about a 90 just before I came in here.
Yeah, and then we just talked about that. You had pain going down the legs. Can you tell me exactly where in the leg was that pain?
It came right out of the lower back and across the left butt cheek and down the side of the leg, through the calf, and across the top of the foot.
So this is typical what we call L4 and L5 radiculopathy, and that was based on you having a scoliosis with a Cobb angle of 25 degrees, which is significant. So on the medical side, there was no question that you have a medical problem.
Right.
And yet you went to a place, and where did you go and what did they tell you?
I went to a Mayo Clinic and I sent my, no, I didn't go there. I sent my MRI down there and they look it over and they send you back the results and they said they don't see any reason for any surgery at all.
Well,
which really confused me.
Yeah, but you had this pain wasn't in your head. We
Right.
had a reason for your pain. You went to another surgeon. What did the other surgeon tell you?
He told me I'd have to go through the front,
Open up your belly
yeah,
Okay.
one day and then come back 3 days later and then go through the back.
and do the other surgery and finish it up. And you really needed that surgery. It was something wrong with you. You weren't imagining that pain.
Right.
But you didn't do that either. So we did that scoliosis surgery yesterday. We did a multi-level fusion. That surgery took us literally 72 minutes skin to skin, and we lost 73 cc of blood in your surgery.
That's great.
Well, you already have walked, already have you not?
Yes, I did.
So how did that go?
Much
How's the
better.
walking go? Much better. And the leg pain, that sciatica that you had before the surgery, how is that now?
I don't feel it at all.
You don't feel it at all?
No.
So we could do with the 72-minute surgery what Mayo wanted to do in 2 days.
I found a good doctor on television.
Oh, thank you. Now, how does it make you feel, though, that they tell you there's nothing to do?
It made me feel really confused. I mean, because
Yeah.
I got 2 other deals from the 2 other doctors. They both said you got to go through the front and the back. And that's when I was watching you on television. You said, no, I don't have to go through the back.
Have
Or
I
through
so
the
far
front.
delivered?
What's that?
Have I so far delivered what you were expecting?
You delivered great.
Excellent.
You did a super job.
Yeah. Overall, the surgery was not even 24 hours. The surgery was yesterday afternoon, and we have finished the surgery yesterday afternoon. You already have walked. Is that correct?
Correct.
Today you are going to get physical therapy, and most likely you will be ready to go home today. Do you feel you are ready to go home possibly today?
Pretty much.
Yeah. So I see you have been ordering breakfast. I apologize. I interrupted you ordering breakfast.
That's okay.
Yeah, and and I see that you have already walked. So most likely before noon, before 24 hours, after scoliosis multi-level fusion, you will be ready to go home. Where Mayo wanted to do a 2-day surgery on you, and the other surgeon wanted to open anterior and posterior. I apologize. The Mayo did not want to do surgery on you, and the other surgeon wanted to do anterior and posterior in 2 days staged.
Right.
Which is today, unfortunately, for most of patients, the reality.
Yeah, I'm ready to go home by the time they do the second operation.
Yes. Well, do you have any other comment or question for me?
No, that's just the thing that scared me was going through the front.
Yes.
They said there's a vein that's on the backbone or something, and you have to be really careful to move
Yes.
that.
Yes.
He said it depends on the age how easy that moves.
Yeah, and just
And
heard
that
that,
kind of worried me.
and it should worry you, because I just heard from a nurse who was a part of the University of Minnesota. They stopped that program going from the front and the back because of significant complication, and that is scary. Opening up your
It is.
belly and going down from the back, we call it 360. I just heard that University of Minnesota stopped that program because of complication,
That's good.
and that's a reality. Well, thank you so much for your interview. I really
Well, thank
appreciate
you for
that.
being on television so I could find you.
Thank you.